Hello everyone, today you're going to watch me pull a patient's wisdom teeth.
This is info, I'm about to get my wisdom teeth removed.
And if you have an upcoming appointment to pull your wisdom teeth, or you're thinking about maybe it's time to get those wisdom teeth out, you're going to see exactly what happens on that appointment. This is Dr. Tamisha Denis, and this is The Modern Smile. So most of the time when I talk to a patient about having their wisdom teeth pulled, they're not terribly excited to hear that I'm suggesting that. There are many reasons that we talk about pulling wisdom teeth, and especially for young people in their late teen and early 20 years, it's a common conversation. Now, it is not always necessary to have your wisdom teeth pulled, but before we actually watch me pull someone's wisdom teeth, we're going to talk about a few reasons that you may have to consider getting your wisdom teeth pulled. Before we talk about the different reasons that you might need to have your wisdom teeth pulled, we're going to talk briefly about what the wisdom teeth are. So simply put, we have 3 molars that form in every section of our jaw. The first molar, the second molar, and the third molar. The third molar is what we consider the wisdom tooth. And just to give you kind of some of the terms that we use sometimes, the first molar we usually call the 6-year molar because most people get it when they're about 6 years old. The second molar is what we usually call the 12-year molar because most of those people get that when about 12 years old. And the third molar, we call it the wisdom teeth because normally people get that much later in life. Now that is different for everyone, like every tooth. That could be as early as 14 years old to as late as your late 20s. The most common age in which people start to experience wisdom teeth, pressures and uncomfortable is usually around 19, 20, 21. That doesn't mean that the wisdom teeth cannot be pulled before then or after then, but there are advantages and disadvantages to doing it in different times. So we know the first molar, second molar, third molar is your wisdom tooth. Let's talk about a few reasons why sometimes we have to have the wisdom teeth pulled. Reason number 1, because they come in crooked. Now, crooked can come in a lot of different ways, but what happens is when your wisdom teeth come in, some people do not have enough room for them to come in and to sit straight. And because of that, they may come in at an angle, or they may get stuck inside the gum or in the bone in an attempt to try to erupt because there's not enough space. That is when we use the word impacted. And impacted just means it's stuck. It cannot come out. And because it cannot come out, you end up in a situation where you're in a half in, half out situation where it is difficult to clean. And anything that is difficult to clean, you're gonna get a cavity. Now, wisdom teeth by nature are difficult to clean because they're so far in the back of the mouth. And because of that, even sometimes when they come in straight, we talk about pulling them for hygienic reasons. Again, far back in the mouth, difficult to brush, difficult to clean, you're gonna get a cavity. Now, if you're in one of those situations where you either have a difficult to clean wisdom tooth or your wisdom tooth has come in a little stuck, either in your gum or stuck in your bone, and you're having pain or pressure, that may be some of the reasons that you can discuss with your dentist of whether or not you should have your wisdom teeth taken out. Now, one of the other reasons we take wisdom teeth out, maybe that third reason, is for orthodontic purposes. That means you either are going to get braces and they want your wisdom teeth out, and sometimes with things like Invisalign or Clear Correct or even traditional braces, the orthodontist doesn't want you to have the wisdom teeth, or there's not enough room and the orthodontist wants to make sure that the wisdom teeth do not come in and crowd everything. Another reason is after braces, what happens is if you don't have the wisdom teeth out and your teeth are nice and straight and you get the wisdom teeth, they come and they push everything together and ruin all the hard work and many years that you've put into having those braces put on. So that's another reason that maybe you have to consider taking your wisdom teeth out. All right, so now let's move on to the actual procedure. So now we're gonna go through me actually pulling somebody's wisdom teeth. But before we do, because the procedure starts right as I'm about to pull the wisdom teeth, I'm gonna explain to you what happens before the appointment.
Hey, yo, check it. This is info. You know, I'm about to get my wisdom teeth removed.
So normally before we discuss taking your wisdom teeth out, I usually try to give you some heads up as to what the experience is going to be like, what you're going to experience in the chair. And the reason that we talk about that is because we want to kind of figure out, and I have another video all about dental sedation and sleep dentistry. What level of comfort are you going to need? Is it going to be something like we're just going to do a local anesthetic, or do we have to give you an oral medication to help you feel a little bit more relaxed, like a Xanax? Or do we need something like laughing gas to kind of take the edge off? Or in some cases, people need to be referred to an oral surgeon to be put to sleep in IV sedation. So we're not going to cover that right now because I have another video, but typically we have that discussion before the visit. Sometimes in case of abscesses and infection, I will also prescribe an antibiotic ahead of time to start before, but that's not very often because we're talking about a situation in which we're pre-planning the wisdom teeth extractions. So the first thing you do when you come into the office, we have you sit in the chair. We've already taken a CT in our office, which is a 3D or three-dimensional image that goes around your whole head, and I can see the wisdom teeth in their position and kind of get a gauge for how difficult or how easy the extraction is going to be. So
Yo, I sound crazy right now. I can't feel a thing. You know what I'm saying? My lips look weird, but hey, it is what it is. You know?
So once you come in, you have a seat in the chair. Usually we take a moment to talk about if you're afraid, if you have any questions, and then we start to talk about what is going to happen. And for me, I have the gift of gab, I should say, so I do a lot of talking to help to kind of allay people's fears. Some people want to hear all the details, and some people just say, get it done. Mostly what I try to describe is what you're going to feel. So the first thing we talk about is the anesthetic. So what I do is I place topical anesthetic in the areas. So let's assume when we're doing 4 wisdom teeth, upper right, upper left, lower right. I place a topical anesthetic on the area. I place a piece of gauze on there, and we let that sit for a few minutes in order to get the edge off. So the next thing we're going to do is we're going to numb. So this is the most important part, and I spend a lot of time getting people numb and making sure that they stay numb, because if you're numb, I can do just about anything. So we place the anesthetic in the separate areas, top and bottom. Usually we call that an infiltration on the top because about there is the only part that's going to get numb. And on the bottom, I do something called a inferior alveolar block. That means on the bottom, usually your tongue is numb, your lip is numb. I'm sorry. Like my lip is numb. Your tongue is numb. Your lip is numb. And pretty much all throughout the bottom of your jaw, you feel pretty numb. I love it. I love it. I love it. He said he tried to rap and everything. All right. I always say, if it's very difficult for you to speak, I think we've done a pretty good job. So that's what we're trying to accomplish. After I place the anesthetic, I let you sit there for 5 minutes or so, and then I'll come in. We'll kind of look, suction, clean out some of the bad tasting things that are in there. And then what I'll do is I'll add a little anesthesia around the different areas. Usually on the upper, the palate, I'll add a little anesthesia. I try to go very gently because that's probably one of the most uncomfortable places to get anesthesia. And then I'll kind of pinpoint all around the different areas just to make sure that you're numb. At this point, I'm very perceptive. I ask a lot of questions. I'll say, do you feel that? Do you feel that? Do you feel that? Because I want to get a gauge if we're ready to go or if we need to wait a little longer. Everybody's different in how quickly anesthesia starts to take effect, so we take our time on that. The next thing I do, and that's just how I work, I like to work upper right, upper left, lower right, lower left. So upper right, upper left, lower right, lower left. And I just go in order according to the way I feel. So what we do when we're pulling a wisdom tooth out, and this is for people who really want to hear the technical pieces of it, and it's not that easy to see on the video, but what I do is, imagine this is the tooth. I'll go around the rim of the tooth where the gum meets the tooth, and I'll kind of just loosen the gum around what's called a periosteal elevator, and we'll just kind of go around there. Remember, you feel nothing.
All right, so let me explain to you what you're gonna feel. You're gonna feel a lot of pushing and pressure. The first one is gonna be the most weird because you've never felt it before, right? Once you feel that, kind of how when I gave you that first shot, you were like, what? And then after that, it got much better, and that's because you kind of understand the sensation, right? So you're gonna know that I'm doing something kind of like you know now, but it shouldn't hurt, right? If it does hurt and it feels like a pinch, because I think you can tell the difference, you're gonna raise your left hand for me so I can stop.
Then after that, then we'll take what we call an elevator, and it's a straight instrument, and it kind of goes in between the tooth that's in front of it and the tooth we want to pull, and I kind of twist it. Usually on the upper tooth, I can get it out just like that. And the younger you are, the easier that is, and we can kind of just pop those wisdom teeth out on the top. Now remember, if you have an impacted tooth, sometimes I might need to have a scalpel or a blade to cut the gum open. Again, you don't feel anything, and to release the gum so that I can see the tooth. And then I do the same thing. I kind of go in between the tooth and move it back and forth until the tooth starts to lift up. Now I'm describing a very simple situations. Sometimes it's a little bit more difficult. Maybe you have to cut the gum like I talked about before, or maybe I have to use a plier.
All right, that's that pressure we were talking about, okay? This is just my finger for support.
Which is something that most people think of when they think of having a tooth taken out, which grabs the tooth like this, and I wiggle it until I can get it free, or sometimes I have to drill. That's what we call a surgical extraction. Now, I don't let people get wrapped up too much in the details of how I'm going to take the tooth out, because I have a variety of instruments and things that I do to take it out. But
it's a lot of pushing. It's my finger.
The reality is, the only thing that you should feel is pressure. You will feel pushing. What I tend to do is come into the room and push on the patient's shoulder, and I'll go like this. You see how you can feel me pushing down on you? That pushing down is what you're going to feel in your mouth. So you're aware of the feeling, but it doesn't hurt. And some people are like, I don't know the difference between pressure and the pain. And the reality is, you know the difference between pressure and pain. If it's sharp and stingy, it's pain. If you just know that I'm there and it feels uncomfortable, like I'm moving back and forth, that means that's just pressure. And that's what we're going for.
Jose. Here comes the first one. Got it. All right. That's it. Look at his eye.
It's a boy.
Oh, hell no.
Oh, yes, yes. And it's big too. It has a big root. Big, big root.
Pressure, pressure only. And again, like I said, I'm pretty perceptive. Even though I ask my patients if they have sharp pain, they're going to raise their left hand to indicate, to let me to know that I need to stop. I'm still watching their eyebrows and their foreheads, if they wrinkle up, if they're making these like strained faces, so I can know if it's something that's causing them pain. Some people, that just makes them feel better to make faces, but some people, you know, they have pain and they just haven't told me yet. I say, you have to let me know. the teeth are taken out, what we will do is we will irrigate the area. Usually we use something called Paradex. It's like a blue mouth rinse. And then if the gums are all loosey-goosey, I will go ahead and stitch you up. The stitches are dissolvable. They fall out at home. Most of the time, people don't even know that they have fallen out. After that, we'll give you some gauze to bite down on. We fold it in 4 pieces and have it placed in the different area to put pressure on the area to stop the bleeding. Most people stop bleeding before they even leave the office. And then we start to talk about post-op instructions. The first thing we say is no sipping or sucking through any straws, no spitting. And the reason that we don't want you to do those things is because the body is really good to form clots and stop you from bleeding and start to heal the area. Send all those good cells to the area to heal you. And if you're constantly spitting or sucking through a straw or smoking, which also does that drawing, pulling action, you pull on the socket and you prevent it from healing. So really, the more you leave it alone, the better. We also ask you not to rinse your mouth. That means you're not going to be going home with mouth rinses and water and going because what you're doing again is you're drawing on that socket, which your body is again very good at healing, and you're disrupting that healing process. So once that is done, so that's one of our major tips. The second tip, again, no smoking. Most people have problems with dry socket, which is very painful, by the way, which is a big empty hole, meaning all you see is bone. There is no blood and fluid and stuff that should be sitting in there that your body's using to heal. No pain medication usually helps that. You just kind of have to write it out. So we want to prevent that, and that's why we go through that. We also give you some other tips and tricks of how to feel better. You can put some ice on your face, and the ice helps to soothe it. You want to stick to kind of cool things, not so warm. Warm increases blood flow and bleeding. You also want to stay away from medications that have aspirin, because aspirin also encourages bleeding. And for the most part, even though we have all of these tips and tricks on how to feel better after you have your wisdom teeth, the reality is you're going to rest and relax, because time is the best medicine. It makes everything go away. You're also going to stick to soft foods, because soft foods is what you're going to have to eat, because we want you to eat something after you have your wisdom teeth taken out. Because if you're taking medications for pain like Vicodin or Percocet or things like that, that stuff can really disrupt your stomach, and along with the antibiotics, and make your stomach feel all queasy. So you want to have something on your stomach. Soft foods like yogurt, like smoothies, like soup, those sorts of things. We also, even if you decide to have soup, you want to stay away from really spicy things, and you want to stay away from really hot things, because now when your your mouth is all numb, you don't have a really good perception of what it feels like in your mouth, so you can hurt yourself. You want to stay away from things that you have to chew, because if you have to chew, you'll accidentally bite your tongue and hurt yourself. I myself have had dental work done and went to eat a sandwich and bit my lip, and so I made myself bleed. So you want to be really, really careful. Like I said, after that, you're just relaxing. I have patients, I take wisdom teeth out, they're going to the movies the next day, they're out and about, living their life, having a good time. And some people, it takes them up to a week to feel better. I always say, prepare for the worst, hope for the best. That means even if I think that you may take a long time to heal, you may not. So that way you have the time. No vacations planned, no tests to do, no weddings or, well, I can't say funerals, but no special occasions that that are planned that you want to have after your wisdom teeth. You want to lay up, watch some Netflix, and relax until you feel better. And of course, you always call our office or your dentist's office if you're not sure if one of your symptoms are the right thing. If something seems a little odd, it's always safer to ask questions. I find that most of my patients don't have a lot of swelling. Everybody worries that they're going to get big chipmunk cheeks, but I don't get that a lot. But I try to keep it as gentle as I can, because even though you're numb, you don't really feel the trauma that's happening to your mouth until after. So the more the dentist can be gentle, the less trauma you normally have and the less swelling you have, even though that's not always preventable. I hope you learned some things from this video today, and I hope that some of this information helped you to feel a lot less anxious when it comes to your upcoming visit to have your wisdom teeth taken out, feel free to comment below. I always answer all of the questions to the comments that I get. And if you have any other videos that you'd like to see me do, any other topics you'd like to see me cover, and that way I can make more content to help to allay some of your fears that have to do with dentistry. Make sure if you like this video to give it a thumbs up and also subscribe to the channel. Thank you for watching.